Can nitric oxide explain my asthma shortness of breath? Imagine trying to breathe through a straw that keeps narrowing. That's what it can feel like when you have asthma and experience shortness of breath. But what's really happening inside your airways? One key player is a gas called nitric oxide. Nitric oxide is produced naturally in your airways by cells lining your breathing passages. It's made by enzymes called nitric oxide synthases. There are different types of these enzymes, and they help produce nitric oxide for various reasons. Under normal conditions, nitric oxide helps relax your airway muscles, making it easier to breathe. It activates a signaling molecule called cyclic guanosine monophosphate, which causes muscles to relax and air to flow more freely. But in asthma, things change. When your airways become inflamed, immune cells like eosinophils releases signals that increase the activity of the inducible form of nitric oxide synthase. This leads to higher levels of nitric oxide in your airways. Elevated nitric oxide is a sign of inflammation and can actually make symptoms worse. It can cause your airways to produce more mucus, swell up, and narrow, all of which make breathing difficult and cause that feeling of shortness of breath. High nitric oxide levels can also react with other molecules in your lungs to form reactive nitrogen species. These can cause oxidative stress, damaging your airway tissues further. This damage can interfere with the normal relaxing effects of nitric oxide, making your airways even more hyperresponsive and prone to narrowing during asthma attacks. Doctors measure the amount of nitric oxide you exhale, called the fractional exhaled nitric oxide, or FeNO. If your FeNO levels are high, it indicates active airway inflammation. This test helps doctors diagnose asthma and see how well your treatment is working. When you use inhaled corticosteroids, they reduce inflammation and lower nitric oxide levels, which often helps improve your breathing and lessen shortness of breath. So, in a way, nitric oxide plays a dual role. It can help open your airways when everything is normal, but in asthma, its increased production due to inflammation can contribute to the very symptoms you want to avoid. Managing inflammation with the right treatment can help keep nitric oxide levels in check, easing your shortness of breath and helping you breathe easier.